Did you know your daily tea ritual could be sabotaging your health? While tea is often celebrated for its antioxidants, emerging research reveals alarming side effects that demand attention. How exactly does tea interfere with iron absorption in your body? Can regular tea consumption lead to chronic fatigue and anemia? Why do nutritionists warn against drinking tea with meals? What hidden compounds in tea block essential mineral uptake? Are certain populations more vulnerable to tea's nutrient depletion effects? Most shockingly, could your beloved beverage actually be weakening your immune system over time? The tannins present in tea form insoluble complexes with dietary iron, particularly non-heme iron from plant sources. These natural compounds act like molecular traps, capturing iron before your body can absorb it properly. When you consume tea within 1 hour of eating, these compounds bind to iron molecules in your digestive tract, preventing proper absorption. The binding process creates chemical structures too large for intestinal absorption, effectively flushing nutrients away. Studies show this effect can reduce iron absorption by up to 60%, with some individuals experiencing even greater losses. Regular tea drinkers may develop iron deficiency without realizing the connection, as symptoms like fatigue and pale skin often appear gradually. Women of childbearing age and vegetarians face particularly high risks due to their increased iron needs. The problem intensifies when combining tea with iron-rich vegetarian meals, creating a perfect storm for nutrient depletion that supplements alone can't always correct. Chronic tea consumption alters stomach acidity levels, creating an environment where minerals struggle to dissolve properly. This acidity interference affects not just iron, but also calcium, magnesium and zinc absorption, all crucial for numerous bodily functions. The pH changes make these minerals less bioavailable, even when consumed in adequate amounts through food. Many heavy tea drinkers report muscle cramps and brittle nails without understanding the underlying cause, which often traces back to chronic magnesium deficiency. The diuretic effect of caffeine in tea further exacerbates mineral loss through increased urination, creating a double depletion mechanism. Over years, this cumulative effect can lead to measurable bone density reduction and increased fracture risk, especially in postmenopausal women already vulnerable to osteoporosis. Dental professionals also note increased tooth decay in frequent tea drinkers, as mineral-starved enamel becomes more susceptible to erosion. Tea contains fluoride compounds that accumulate in the body with regular intake, posing risks few consumers consider. While fluoride strengthens teeth in small doses, excessive amounts from multiple daily cups can lead to skeletal fluorosis over decades. This insidious condition develops slowly, causing joint stiffness, bone pain and increased fracture risk as fluoride replaces calcium in bone matrix. Certain tea varieties grown in specific regions contain alarmingly high natural fluoride levels, particularly older leaves used in budget blends. The longer you steep your tea, and the lower the tea quality, the more fluoride gets extracted into your beverage, creating a hidden health hazard. Industrial pollution can further increase fluoride content in some tea-growing regions, adding another layer of risk. Many tea enthusiasts consuming 4-5 cups daily may be ingesting fluoride at levels approaching safety limits without realizing it. The caffeine and L-theanine in combination in tea creates a unique alertness effect that can disrupt natural sleep patterns. When consumed in afternoon or evening, this synergistic blend provides smooth energy, but lingers in the system longer than many expect. Many tea drinkers underestimate how long caffeine remains active in their system, leading to reduced sleep quality even when they fall asleep easily. The disrupted sleep architecture prevents proper deep sleep cycles, where crucial cellular repair occurs. Poor sleep then triggers a cascade of health issues including weight gain, impaired immunity and cognitive decline over time. The stimulant effect also stresses adrenal glands over time, potentially contributing to burnout syndrome and hormonal imbalances that conventional medicine often misdiagnoses. Evening tea drinkers frequently report waking exhausted despite adequate sleep duration, unaware their bedtime ritual causes the problem. Polyphenols in tea that provide antioxidant benefits also act as potent enzyme inhibitors in your digestive system. These compounds interfere with protein digestion by suppressing pepsin activity, leaving larger undigested fragments that may cause gut irritation. They also impair fat breakdown by inhibiting lipase enzymes, potentially affecting fat-soluble vitamin absorption. Regular tea drinkers may experience bloating, indigestion, and nutrient malabsorption without connecting these issues to their beverage choice. The inhibition effect lasts for several hours after consumption, meaning your afternoon tea could be compromising digestion of your evening meal. Those with existing digestive issues often find symptoms worsen with frequent tea consumption, though they rarely identify the connection. Even healthy individuals may absorb 10–15% fewer nutrients from meals accompanied by tea, creating gradual deficiencies. Long-term tea consumption affects thyroid function due to its goitrogenic compounds that interfere with iodine uptake. These natural chemicals can suppress thyroid activity by competing with iodine, essential for hormone production. While moderate intake poses little risk for healthy individuals, those with existing thyroid conditions or iodine deficiency may experience worsened symptoms. The combination of caffeine-induced stress response and thyroid interference creates metabolic disruptions that can manifest as unexplained weight fluctuations, temperature sensitivity, and energy crashes. Many habitual tea drinkers remain unaware their beverage could be contributing to these persistent health mysteries. Some develop subclinical hypothyroidism that goes undetected in standard blood tests, yet causes daily discomfort. The stimulating effects of tea may temporarily mask these metabolic issues, creating a false sense of well-being while underlying problems progress. Make sure to hit that subscribe button, give this video a thumbs up, and share it with your friends and family. Thanks a bunch.